Hello, my name is Dr. James Shamia. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. As the Omicron situation continues to worsen, we felt that it was important to give you another update today of the overall status from a hospital perspective. So let's get started. This graph shows the hospitalizations in the East Tennessee region as defined by the counties on the bottom of the slide. There have been some data reporting changes in the last week, so notice that the graph stops at January the 8th, but I've added a number in the box to the right. So as of January 11th, the hospitalizations were up to 429. You will note that the red line, which is the intensive care part, is not really increasing at the same rate. And so I would view that as a positive in this surge so far, this wave compared to the Delta wave. This is the hospital census at our medical center. You see we're up to 112. We were at 77 when I updated you a week ago. What you see on the right-hand side has been that there's been a significant increase, but the orange, which is intensive care, really parallels what we saw across the East Tennessee region, is that the ICU is not increasing at the same rate. This slide shows hospitalization data across the state. So we've taken the state as a whole, and then the four main population centers. Those districts are defined by the Tennessee Hospital Association. The first column is the number of current COVID-19 patients they have in the hospital as of yesterday. The next column is their prior peak of hospitalizations during the Delta wave, and the final column is the percentage that they are currently compared to that prior peak. So for example, in Knoxville, 391 patients currently in the hospital. During the Delta wave, that peaked at 697, so the Knoxville district is at 56% of that prior peak. You'll note that Memphis, who did not peak as high as we did during the Delta wave, is already at 102% of their prior peak. And so we're going to be watching the data across the state very closely. So one of the most frequent questions we've gotten in the past week is related to what's known as an incidental COVID-19 hospitalization. So I want to try to address this. So an unofficial definition of this is a patient who's hospitalized for an entirely different reason than COVID-19, but is incidentally found to be infected with COVID-19. So as an example, at our hospital, patients who present for childbirth are routinely tested. If one of these tests returns positive and the patient is not having symptoms of COVID-19, this would be considered an incidental case. At our hospital, the vast majority of tests are ordered due to clinical suspicion of COVID-19. So we would not expect a high incidental rate. Now, why would incidental cases rise with Omicron? It is so widespread and at times it's asymptomatic. It's simply everywhere. So it stands to reason we might see more of incidental cases this time around. So two take-home points. Our experience continues to be that the significant majority of our patients in the hospital with COVID-19 are sick because of COVID-19. But it's important to realize incidental cases still affect healthcare delivery. Caring for any patient with COVID-19 due to infection control measures is more complicated and labor intensive. So what's different in the healthcare delivery system this time around? Well, first of all, and we've discussed this previously, healthcare staffing nationally and locally was already significantly affected prior to the Omicron surge. That's due to a combination of clinical staff choosing to leave the bedside and sometimes choosing to leave healthcare altogether, staff leaving for travel assignments in other COVID hotspots, and retirements earlier than expected. Also this time, we were having record numbers of staff out with illness. And then external staffing resources like the National Guard that were available during the Delta wave are not currently available at this time. So what does this mean in terms of healthcare delivery? Regardless of the total census and how many cases are incidental, the healthcare delivery system is stressed, and this will likely worsen in the coming weeks. Part of the response to prior COVID-19 waves was for the hospitals to create and staff surge areas. These are extra patient care areas or beds that are created to provide care for the additional patients. This is much less feasible with the current wave. The hospitalization peak for the state of Tennessee is projected to be late January, although there will be some regional differences. The hospital COVID-19 census may meet or exceed the total during the Delta wave. And so this is certainly something we're concerned about and watching closely. I want to make a quick comment about a new treatment called Evusheld. This is a treatment, it's an injection, and the intent is it's to prevent COVID-19 in patients who don't have COVID-19 who have moderate to severe immune compromise and may not mount an adequate response to a vaccination. We have a limited supply. I'm not going to read all the details on this slide, but we wanted to make you aware. If you have a question about whether you may be a candidate, we recommend you contact your provider. So what I've portrayed here today is a worsening situation related to the Omicron variant. And we all sense how quickly Omicron is spreading. So we're going to be watching this situation very closely, and I'll wrap up with community next steps. And these are the same as last week. Regardless of vaccination status, renew mask wearing. Remember that breakthrough cases after vaccine and boosters are not considered vaccine failures. Vaccination, and particularly boosters, provide protection against severe illness and death. Obtain flu shots, obtain initial COVID vaccines, restimulate immunity with COVID-19 boosters if you are a candidate. If you have symptoms, get a COVID test, and then follow the isolation and quarantine guidelines from the CDC. And the best thing to do, as this does change, is to just go to this website. So as always, we appreciate your attention, and we'll plan to be with you next week to provide another update.